Good morning, Healing Spot community. This is Justine, and this morning I'm going to be interviewing Amy Vander Linden. And so I'm just waiting for her to pop in here so I can add her on. I know she's ready. So we're going to be talking about pregnancy, postpartum, and your pelvis. So Amy's going to share her expertise in women's health. Let's see if she's on here. While we're waiting, I'm just going to introduce you a little bit. So Amy Vander Linden has been a physical therapist for more than 18 years, and she specializes in the John F. Barnes Myofascial Release Approach. She is the owner of Moment of Truth Physical Therapy in Phoenix, Arizona. Amy has found myofascial release to be the most effective way of eliminating painful restrictions and restoring mobility. She has worked in a variety of settings from children to adults and the elderly with a passion, and she has a passion for helping anyone who is suffering and limited from living life to the fullest. Myofascial release addresses all types of ailments by relieving restrictions that can be causing up to 2,000 pounds of pressure on pain-sensitive structures. Amy has over 350 hours of specialized training by John Barnes in the myofascial release approach, including women's health. Okay, I see Amy here, so I'm going to just pause. I'm going to read her bio after I add her on. So Amy, and hi Rowena, thank you for joining us. So I'm going to bring Amy on. So hopefully this works, and you should be able to see myself and Amy side by side. Hey, good morning. How you doing?
I'm great. This is so fun.
Yeah, thanks for coming on, Amy. I'm just reading your bio because it took just a little bit to find you. So I'm just going to finish reading this. So Amy has a passion of helping women thrive through pregnancy and afterwards, whether they had a baby 6 weeks ago or 16 years ago. Postpartum is forever. She assists them towards wholeness by empowering them to know their bodies, understanding healing processes, and offering therapeutic touch, gaining confidence in their ability to do the things they love, and providing education so they and baby can have an optimal start. So I'm so excited to have you here today, Amy. So we're just going to get started with some questions. If watching, if you guys have questions while we go along or comments, just leave them in the chat box and we'll do our best to see them and answer. Okay. All right. So Amy, tell us a little bit about how you became a physical therapist, and yeah, let's just start with that.
Okay. Well, I broke my hand playing high school volleyball and had quite a bit of therapy for that, and decided that I didn't quite want to be an OT and focus just on hands and some of the things they do, which I had no idea back then. But that was my first interest into physical therapy. And so I graduated from U of A and went to grad school in Boston, and I've been a PT 18 years now. And yeah, in 2009 is when I started discovering John's stuff. And I worked in a couple different settings before that, and used home health to kind of merge into my own practice, which I've been doing since 2012.
Wow, awesome. So did you have an idea that you would be doing like outpatient orthopedic physical therapy? Is that what, I mean, obviously
I think that's what everybody thinks when they go to PT school. One of the things I love about physical therapy is how many different settings that we have the flexibility to work in. And so, yeah, school definitely opened my eyes to that. My affiliations and internships opened my eyes to all the different possibilities. And I've worked in a few, and there's still dozens more possibilities, even besides that. So,
yeah, absolutely. So tell us how you became interested in doing women's health and becoming a pelvic specialist.
I had already had my kids, even when I first took my first John Barnes myofascial course. But I think just, you know, as a mom, the things I went through, and then so many more of my friends were having kids, and so babies and mamas became sort of part of my world. And the more classes from John that I took, hearing about women's health and sort of just considering that I honestly, I've looked back on this so many times, Justine, and when I very first took the women's health course in March of 2012, um, I do not know exactly why it felt so critical right then. I just remember thinking something even came up with my son that almost kept me from going. And I remember thinking I wouldn't be able to go till the following year because that course is only once a year, sometimes more now, but it just felt incredibly urgent. And I'm extremely grateful that I did. And I've even since repeated it and obviously taken other pelvic courses as well. But it's just, it's a growing field. I'm grateful we've got more and more therapists coming out of school interested in it. But even then, there were hardly any. And I just felt so compelled to start working more and more with moms. And that just felt like such a critical next step.
Yeah. Well, it's such an important part of physical therapy. And unfortunately, a lot of people don't know that physical therapists offer the type of work that you do. So, so I'm glad you came on today to help educate that. Okay, tell us a little bit for the ones that don't know, what is myofascial release? Tell us, in a brief description, and why do you feel that myofascial release is more effective than traditional physical therapy in treating your mamas?
Well, so your fascia is your connective tissue. And so we learn kind of about well, not in school. When you start studying it, you learn about the web that's connected head to toe. So that's critical just from a standpoint of being one of the only truly continuous structures in our body. And it truly does influence everything. I think even more important than that, and a little bit more difficult to explain than that, is our ground substance. And so, disease is looking more and more at inflammation now. So they're starting to recognize the role of our ground substance. But in that fascial web sits what, we learn in grade school, we're 70% water. Well, of course, it's not exactly water. And it has its own structure to it. And as you know, when we have inflammatory processes, trauma, surgeries, that starts to thicken, harden, solidify, and can prevent our cells from communicating with each other, can create restrictions in areas we're not even aware, because sometimes where that starts to thicken isn't even where the original trauma took place. And just being able to influence the whole body in that way has been really powerful. Even within the physical therapy and pelvic community, I've somewhat felt like a black sheep coming at it, sort of not through the traditional pelvic PT way, but more through the Barnes myofascial being my foundation. And I'm grateful for that now and embrace that now, because pelvic work, all healing therapies are sacred, but pelvic work is to me all the more sacred and requires such an extra level of trust, besides just putting your hands on somebody. And I feel like John really prepares us for that in the way we connect first and do therapy secondarily. And so I've just been so grateful for that background and that training so that I can approach it from that standpoint and hopefully create what feels like a safe space, and have the chance to hear birth stories and honor that, and just create a level of healing that I just don't think is always available with some traditional modalities.
Yeah, very good. So tell us a little bit about who you help. Like, what are the moms suffering with that walk into your clinic?
Well, my absolute favorite thing is working with pregnant and postpartum moms. And a large part of it is what we touched on at the beginning with, we spend so much time preparing to get pregnant and preparing for baby's arrival and preparing for our pregnancy and learning about delivery. And I rarely hear a lot. It's getting more. Notice that fourth trimester, some people are calling it, and postpartum, but that's even longer lasting than pregnancy, which is 10 months. I think sometimes we forget the extent of time that it takes for our bodies to change and make a baby. And then the delivery itself, no matter how bad it goes, is usually going to be a max of 2 to 3 days max. And most times is less than 24 hours. Yet our whole focus is on that delivery. And I just don't think after that it just becomes about baby, and we're somehow expected to just heal There's that arbitrary 6-week checkup where often no internal exam is even done in most women. And then they're just supposed to sort of figure out what life is like now and get back to exercise and get back to sex and work and whatever else they do, never mind carrying this child who's growing rapidly, and the stroller and the car seat and the diaper bag and all of these things. Meanwhile, with this tissue healing inside of us that is just not even discussed or really help provided. So I think a lot of my passion just comes from the fact that I just don't want women to suffer not knowing, and I don't want them to suffer alone. And I really, really jump on a soapbox when it seems like women are told, oh, well, you've had a baby. Yes, they had a baby. And now they can recover, and there's help for that. And it's not like, oh, I'm going to pee my pants now because I had a baby, or any of those things. We just suffer in silence, and that's my passion. I don't want that.
Yeah, and the focus is so much on the baby that I think a lot of moms have guilt or whatever, that if we have to speak up and say, wait, hold on, what's going on here? We're kind of, I don't know if frowned upon is the word, but you know, the focus is so much on babies.
Yeah.
And
moms put themselves last, and that is the beginning of it for sure.
Yeah. Yep, for sure. So yeah, you mentioned some of the issues like incontinence. Can you name any other, say, because people are kind of like focused on diagnosis,
right?
You know, and we know myofascial release therapist, like John says, a diagnosis is a myopic description of symptoms. Like it's like looking at a whole body, like, you know, through this little eye hole. And so instead of doing that, you know, we're taught to look at the whole body, but people identify with those diagnoses.
Yeah, for sure.
So what kinds of things might somebody get diagnosed with at their OB, you know, GYN or their midwife? What are some of the things that they're talking about in the doctor's office that, you know, would be a typical diagnosis?
Well, I think the main things that people are familiar with are diastasis recti or abdominal diastasis. That's where there's the separation of the ab muscles. And let's see, I've got some statistics. So more than 50% of women have some level of diastasis. And that's when I find that kind of paralyzes women, because there's so much information out there. There's some great online programs, but if women don't get their own bodies checked so that they know a confident starting point, they don't even want to pursue those programs because they're told, don't do this, or yes, do that. And they don't know how bad it is, and they don't want to make it worse. And so then they just go months and months of not exercising because they don't know what to do safely or how to pick up baby and all those other equipment things we talked about. So diastasis is one. I think another common one is leaking or incontinence. The most common one, postpartum or pregnancy related, is called stress urinary incontinence. That's that one where if you laugh or cough or jump, sneeze, that we have some leaking. And you know, that's 35% of new moms suffer with some stress urinary incontinence. And that can happen during pregnancy, and we think, oh, baby's just pushing on the bladder. But I'm talking 35% of women, that's after delivery. That's after they've, quote unquote, had that 6-week healing. They're still having leakage. The other thing with diastasis is we think, oh, it's just my abs, I'm okay, they'll heal up. But that's the leading source of the stress urinary incontinence, or back pain, or sometimes pelvic pain as well. Painful sex is another really common one. I find that tends to be worsened if they had some pelvic floor issues during pregnancy, but it can also be significantly impacted by episiotomies or tearing, where they've had some stitches. Sometimes people, I think, expect to have a delay in return to sex if they've had some stitching, but I don't think they really are taught that, or even a C-section scar, how the scar tissue can play into things and cause problems on an ongoing basis or down the road, even if things seem fine initially. But it's completely treatable, and only in a few sessions usually. None of this stuff with just basic postpartum care, I have not found that it takes more than usually 3 to 6 sessions. And sometimes it's one. It's just like a checkup. They just want to know, how is my Kegel? How are my abs? How are things down there? Did they go back to where they're supposed to be? They just want some guidance and a thorough exam. so that they can feel confident. And I love to do that. Just, yes, absolutely, you are cleared for all of those things, and here's where to start.
Yeah. Well, and you mentioned earlier a lot of at that 6-week appointment, women aren't really even examined, and so, but they're told maybe to do Kegels. That's kind of the common prescription for any kind of pelvic floor issues, is do Kegels. But without a true internal exam, how do you really know if they need Kegels or more of a down training or reverse Kegel program? And you know how important that is.
When it's so rare, that I find clients to just be weak, where it is just, yes, go do Kegels. There's usually some areas that are tight and sore from delivery. 25% of women that have pregnancy-related pelvic pain continue to have pain after delivery. And 20% of first-time moms have some severe tissue trauma in the pelvis with a completely, what would be considered a normal, healthy vaginal delivery. I just don't think we really know or have a grasp on what happens to all of those tissues. It's like most of the times it's under dramatized, and this is a little bit of an over dramatization, but to some degree, you're kind of taking a sleeve and turning it inside out as baby comes up. Obviously, all of that tissue doesn't get pulled out of the vaginal canal, but in terms of the pull and the drag and the stretching of that tissue, again, that's built up over 10 months, and then the dramatic contractions. I just don't think we have an appreciation for what those tissues truly need for healing time in terms of when to get back to certain activities. All of that to say, I mostly find a combination of, yes, some things might be a little stretched and weak, but some things are tight and guarded from protecting the pelvis and from things that happened during delivery. Absolutely, Ro. That's rough.
Yeah.
And at least you know what you need to get back to. But even when us therapists have our own stuff going on, like I can't really even effectively check my own Kegel, even though I quote unquote know how, because when you reach around, it changes the angle of everything. And so that's what I try to do with women is just, okay, what's tight, what's sore, let's treat and resolve those with the myofascial release work, and then give them the feedback they need to successfully either down train or, which is like a relaxing of the pelvic floor muscles, because sometimes they're in spasm or tight, or how to properly do Kegels and in what positions might be best for them, and reassure them whether or not they truly do have any kind of prolapse. And there's several different kinds in that regard too. So yeah, just a thorough exam so they really know what's happening with their body. That's the most critical thing.
Yeah, assessing them and making it individualized. Yeah, and then reassessing, so you're not just sending them out the door after one visit. Yeah,
make sure they're confident they're healing.
Yeah. So let's see, is physical therapy safe during pregnancy? Like, what are some of the things you see, maybe some of your pregnant mamas that come in, what are some of the things they're complaining about and that you're able to help them with?
Back pain's obviously a huge one. I think it's so common. We all have asymmetries and postural stuff, right? But obviously as the relaxin hormones are shifting and you're growing, I think it's even more prevalent for women to have some shifting of the pelvis that happens that can cause radicular pain down the leg, or what people often call sciatica, pubic symphysis dysfunction, or sometimes called SPD, the symphysis pubis dysfunction, where you get that really sharp stabbing pain right at the pubic bone in the front. That can happen when the pelvis shears. And a lot of women have often been told, well, that nothing can be done until after they have the baby. And that's not true. I have clients routinely that I'm able to help doing some manual therapy to help relax what's torquing the pelvis, and then just strategies too on how not to aggravate that further. I do have a free report on my website that's 6 tips to avoid back pain during pregnancy. That's completely free. People can grab that right on the homepage. And then there's also a postpartum checklist kind of for after some of those things like we've been talking about, just so women know what there's help for, and that they can kind of just go down the list and be like, oh, I'm actually fine. I'm fine. Oh, that one I have some questions about. And then they know what they can possibly reach out about.
Right.
And so yeah, pubic symphysis pain, back pain are two of the biggest. Some women have some stuff going on with their tailbone. I had a midwife refer a client to me because she has a background. She's been a dancer for years and years and years. She has a lot of muscle tone and strength, but she also has a very tight pelvic floor. And they were concerned. She wanted to have a natural delivery in a birth center, and the midwife was concerned that without some pelvic floor work, she might have a more difficult time of it. So we did some sessions, and she had a great vaginal delivery in the birth center. So sometimes just those kinds of things, if people are having any pelvic pain or painful sex even ahead of time, we can't always help leaking during pregnancy, but sometimes we can. Rib pain is another one, especially depending on mom's build. She might be more short-waisted, or baby might just, I had one mom, this one particular weekend, baby was really active and she just kind of had a rib. The cartilage got irritated in the front and the ribs sort of shifted in the back. So she was having really sharp rib pain. We were able to help her with that.
Oh, good. Good deal. Yeah, when we're done here, why don't you share your website so people can go and grab those free guides that you have available. So remember to put them in the chat box.
Okay.
So let's see. I was trying to keep this to 20 minutes, and I know you laughed at me, Amy. I'm like, well, we'll do what we can. So let's see. How long do you recommend? Just a good starting point. I know this it's going to depend, obviously, on people. But how long do you recommend that somebody waits until after they've had a baby to get back to exercising? And where's maybe a good place to start? Can you address that?
Well, that 6-week mark is kind of the gold standard for getting their checkup. In an ideal situation, they would get postpartum physical therapy at that point. Even possibly, I mean, it varies greatly between OBGYNs and midwives and everything, how thorough that 6-week checkup is. But I would recommend getting a check before starting exercise. And then it's more on how they're feeling and how they're healing. It also depends on how much exercise they did during pregnancy and prior to pregnancy. Everyone's starting point is going to be different. And I think women just need that support and encouragement so they can resume something confidently.
Yeah. Well, the other thing, I think I had a patient recently I want to share. Her doctor said, well, do whatever you were doing before. She goes, well, I was running half marathons. Should I just go out and run? That's not a good thing to say. Just go ahead and do what you were doing before. It's not a good starting point. And so luckily she referred herself to me. The other thing is to take into consideration is whether or not someone's still breastfeeding, because that's going to affect the recovery process as well. It's going to prolong that. So
absolutely. And I always start them with how they're breathing and Kegels going so that they have that foundation they can use when they are running or when they are lifting. And yes, I mean, bridges and push-ups and air squats are kind of my go-to to start with. But yeah, if they're having any kind of sagging feeling or heaviness or are concerned about any kind of prolapse, that needs to be adjusted. So really important just to get checked so that they feel confident.
Yeah. So how would someone go about finding a women's health physical therapist in their area? I know you're in Phoenix, so if no one is local to you, what do you recommend? I mean, because we have ladies from around the U.S. watching right now. So
yeah,
what's a good starting point?
So John Barnes has a myofascial directory. By far, not all of those therapists are going to be women's health, but I always encourage people to check that and at least see who's in their area, because they can even call someone in close and ask, hey, do you know anybody in the area that's women's health? There's a women's health section of the APTA I know that has some therapists listed. I might be wrong on this, but I think you have to be in the women's health section of the APTA, so that kind of rules out a huge chunk of therapists. I know here in Arizona, we have a website that has a directory of therapists. So it can be tricky. I would just reach out to therapists and ask.
I think that's
probably the easiest and most convenient without spending a ton of time on the internet. They can try just searching pelvic physical therapist near me. I mean, Google's brilliant these days. See who's got their SEO on point. And up on their
Yep.
marketing.
Yep.
But yeah, just calling local physical therapists and say, hey, do you know who in my area specializes in postpartum? And even us therapists within the Phoenix area refer to each other based on clients' needs and parts of town. Phoenix is pretty spread out. So, you know,
Perfect.
it's not a real competitive environment. It's a very supportive community.
Yeah. And a physician could be a good place to start as well. Sometimes you just have to speak up for yourself.
Yeah.
Even if they recommend it or refer, it's okay to say, hey, you know, I saw this video. I saw this, you know, Amy down in Phoenix was talking about the pelvic floor. Is that something that I could do, you know, and being proactive and
Absolutely.
And also just listening to yourself too. So, all right. Do you have any like lasting or last thoughts or advice that you'd like to share that I didn't ask you about?
No, mamas just ask, get some help, get some support, get in other mamas groups and talk to other moms. Another chiropractor and I have started a Northwest Phoenix birth circle in this area because we just want moms to be able to get together and feel supported and feel that community, so that women aren't going it alone and wondering if it's them or if it's normal or when they're going to get better. There's a lot of help.
Yeah, awesome.
Thanks so much for having
thank
me
you.
on. This was really fun.
Yeah, it was fun. Thanks for coming on and sharing your expertise. It was really enlightening. So
Thanks,
thank you,
Justine.
Amy. All right. Thanks
Post
everybody
more
for
questions,
watching.
you guys. Hop on our pages. We're
Yeah.
here to help.
All right. Bye-bye.
Bye.